Hello friends, I'm Dr. Vineet Kaul, head and neck cancer specialist and robotic surgeon in Gurugram, and today I want to share my thoughts with you about recurrent throat cancer, especially recurrent base of tongue cancer. So what is base of tongue? Base of tongue is a particular part of the mouth which involves the backmost part of the tongue, the posterior most part of the tongue. This part is medically called the oropharynx. It also includes the tonsil glands. If you had cancer of the oropharynx before, then you probably were treated and in advanced stage, then you were probably treated with radiation and chemotherapy. So by advanced stage I mean stage 4 and above. Then chemoradiation is the preferred treatment. In some of the scenarios where chemoradiation cannot be given, we do upfront surgery. And in stage 1, 2 and 3 of oropharyngeal cancers also we do surgery. There's a little fine tuning that has to be done. So if you have small tumors like stage 1, 2 and limited stage 3 tumors of the throat, then we can do surgery without giving any cut on the neck using the surgical robot. The surgical robot is not an independent robot. It does not do the surgery. The surgery is still done by me as a robotic surgeon. The robot, its arms just give me an access through the small opening into the mouth right into the throat. So the robot is giving an access and an ease of doing the procedure. The surgery is still done by the surgeon. So we can go right through the mouth without giving any cut on the neck and remove part of the tumor. How does this help? So in stage 1, 2 and 3 in the recent past, when we have started doing robotic surgery more in the last 2 decades, we have seen that the tumors which were stage more became downstage. People believe that it's a stage 3 tumor and gave it radiation as well after surgery. After resection, it actually became downstage to stage 2. So that downstaging actually reduces the need for any adjuvant therapy like radiation or chemotherapy. And also in stage 1 and 2, we could only give radiation and chemotherapy in the past 2 decades back, but since the last 2 decades in stage 1 and 2 robotic surgery is enough. Now what that does is it really improves the quality of life. Mouth dryness, difficulty in swallowing is not there that much with robotic surgery. It is more with radiation and chemotherapy. Also the duration of treatment of chemoradiation is more, the side effects are more, so it generally exhausts the patient physically, mentally, and the treatment actually goes on for 6 to 7 weeks. So in contrast, the robotic surgery, transoral robotic surgery, you will recover in 2 weeks. Only stay in the hospital for 3 to 4 days. After the surgery, you are discharged and you can go home, and in 2 weeks you are fully healed and you can resume your normal activities. Another particular clinical scenario, stage 4, most of the times we choose radiation and chemotherapy. Now if in stage 4 you have taken radiation and chemotherapy and after a few months the scan tells that the tumor has come back, which means that there is a recurrence of the cancer, then we do have an option of doing transoral robotic surgery for the recurrent cancer depending on the size and location. Now we are doing that surgery routinely and giving good results. The advantage is that we are pushing such patients who were just put on some palliative treatment like painkillers, basic support, and just some immunotherapy or targeted therapy to just control the tumor, not make it completely go away 100%. We are shifting these patients from that perspective to a curative perspective, where with the help of the robot we completely remove the tumor. It becomes a curative intent. So after that, of course, we might add some adjuvant therapy if required, but radiation robotic surgery, transoral robotic surgery in recurrent stage 4 cancer of oropharynx is enough. That's all I wanted to share. And you cannot generalize treatment for all the patients, especially in the head and neck region. So a head and neck surgeon along with the team of the radiation specialists, the chemotherapy specialists, all the medical oncologists, we sit together, we in a tumor board, and then we take the decision. We take a collective decision based on our past experiences as well as the recent knowledge, and devise a specific plan, a personalized care plan for the patient. So if you are suffering from oropharyngeal cancer or recurrent oropharyngeal cancer, do get in touch with us. We will be happy to provide assistance to you. Thank you.